pain. Now, if you are one of those people who are working away at your desk, and especially if you use a keyboard or do any repetitive type of activity where you are constantly writing, or say you've worked in your garden over the weekend and you've been chopping wood or weeding the garden, or any repetitive activity where you're using your forearm and hand, can lead to outer elbow pain, and this is known as a tennis elbow. So tennis elbow is basically outer elbow pain, which may not radiate down into your forearm and hands and fingers. Now, if you are one of those moms who have a busy lifestyle, you're busy at work with your kids, driving them to and fro classes, etc., it is not very uncommon to have a tennis elbow or a outer elbow pain problem. So there are like a number of treatments, non-surgical, that is conservative treatments for tennis elbow. And if you've tried them all, or if your pain is excessive, your doctor might advise you to get an injection for your tennis elbow. However, if you have been advised an injection, sometimes it can be very confusing as to whether you should go in for the injections or not. Not just for tennis elbow, but for any other joint injections. And there is, if you look into Google, there is a lot of negative and positive reviews on injections. So in this video today, let's talk about, do injections really help with tennis elbow pain? And what are the pros and cons of getting an injection? When would your doctor actually recommend you to get an injection? So let's look at all of these, and that will give you a better base on which you can make a decision as to whether you want to go in for the injection or not. All right, before I jump into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back, neck, and joint pain. And I do this by giving you simple exercises, easy lifestyle tips, tricks, hacks, and I also talk about some non toxic natural products that have helped me in my own spinal and joint pain journey. All right, and I do all this without taking away a big chunk of your time. So, well, we are moms, we're busy people, right? So, without taking more of your time, let's get back into the joint injections. So, jumping straight back in, there are usually three situations in which your doctor will tell you to get an injection. The very first one is that you have tried every other non-surgical option out there and your pain is still quite high. So if you look at your pain levels, they haven't really reduced since you actually got the tennis elbow pain. The doctor will ask you to go in for an injection. The second is if your doctor is considering surgery and injection is a last resort that he wants to try with you before he puts you under the knife, that is also possible. It doesn't happen with every single surgery, but this could be one of the factors why the doctor will ask you to get an injection before the surgery, before trying out surgery. So the third one is that you may or may not have tried every other option for non-surgical treatments like shockwave, dry needling, physical therapy, exercises, stretches, etc. There are numerous options out there. However, your pain is so high. I mean, the pain levels are so high that it is interfering with your everyday activities. So, something as simple as, say, tying my hair back, or driving, or just opening a doorknob, picking up a glass of water, everything is so painful that the doctor says, okay, go and get an injection, get some pain relief. However, I mean, of course, you have to discuss with your doctor as to why they're asking you to get an injection, but these are the three broad outline of why the doctor would ask you to get an injection. So, moving on, why are people so skeptical about steroid injections? Of course, now here I'm talking about injections. I'm not talking about the PRP, that is the plasma rich protein, or the gel injections. We're talking specifically about steroid ones. So, you can discuss with your doctor about the different kind of injections, because I'm not going to discuss them here because otherwise the video will be too long for you. So, with steroid injections, people are usually skeptical because if you have repeated injections, you will be more prone to muscle tears, especially in the tendon area. Tendon is where your muscle is attached to the bone. So, in this case, around your outer elbow. So, the doctors will not recommend you more than 2 to 3 steroid injections in a year anyways. They're going to cap it at that, because then your chances of getting a muscle tear are greater. So if you are one of those who've had a lot of pain and the doctor's like, okay, it's safe to go for an injection, or you don't already have a tear, then you have to sort of weigh your options as to which route you want to go. Now, let's look at the positive side. Usually, with steroid injections, now everybody is different. Keep in mind that results will vary from one person to another, and it may vary within the same person from one episode of tennis elbow to another. So, usually, people get instant pain relief. Instant means after about 24 to 48 hours, but instant pain relief with steroid injections. Now, this, especially if you had a chronic condition, is a situation where obviously people are very happy with the pain relief, even if it's like a 70% to or 90% pain relief. And they one mistake that they do is they stop all precautions and they stop all exercises. Now, be mindful that this pain relief is actually quite short lived. Now, when I say short lived, it could be weeks to months to a couple of months. Again, it depends on the person and how far in you are with your tennis elbow and how much damage is present in the elbow, I mean, and in the outer elbow area. However, if you want to make use of the injection, this is your golden period to do all your exercises. Now, especially if you've had chronic tennis elbow, let me give you an example. Maybe that'll be better. If, say, you have loss of grip strength. So basically, what that means is when you lift a glass with your affected arm, say my right is affected and I'm lifting a glass full of water, as compared to my unaffected left side, I feel the weakness in my right hand. I feel like the glass is going to slip or it feels heavier in my right hand. Now, this is not something the injection is going to address. The injection is only going to address the pain part of it, right? So this is the getting an injection. After that, that golden period that you have, this is the time where you need to work on your grip strength. Similarly, you need to work on all the muscular imbalances that you have. You need to stretch out your tight muscles. You need to go for your physical therapy, go through the treatment, strengthening exercises, because especially if you've had chronic pain, then the doctor sent you for an injection or you have opted for an injection and gone to the doctor. This is where you want to do your strengthening exercises and strengthen that arm, forearm, hand muscles in such a way that once the pain comes back, whatever degree of pain that comes back, you are ready for it, right? So injections are not a long term solution. They are just a stopgap arrangement, but a good one, because you can work on. Obviously, you get a bit of pain relief, of course, but you can work on all the exercises that are going to ultimately help you cure or treat your tennis elbow. Now, a good idea is to discuss with your doctor why they're giving you an injection, and discuss with your physical therapist the plan of action once you get the injection. So, do this before you actually go in for those injections. So, have a word with your physical therapist. If you don't have one, ask your doctor to give you a referral, or walk in if you don't need a referral, and have a word with the physical therapist and plan out some exercises, because you can't just suddenly go to the gym and start strengthening your forearm or your wrist. You need to do it gradually, depending on what stage you are at, how much pain relief you've had, and how many days prior you've had the injection, etc. There are a lot of factors that your therapist would consider. Alrighty, I hope that was useful and it gave you a bit of insight into joint injections. Now, if you are looking for more details on this topic, I have written a blog with the same name. I will leave a link in the description of this video. If you're watching me on Instagram, the link is in my bio. Once you click on my bio or my profile, it'll take you to another page. Once you scroll down, it'll show you blogs, and this will be the first blog on there if you're watching this in real time. Alrighty. If you have any questions, any comments, do let me know. And